Good afternoon, committee members. Et bienvenue. J'ouvre maintenant.
Welcome. I call this meeting to order.
Réunion numéro.
Welcome to meeting number 39
on human resources, skills, social development, and the status of persons with disabilities. Pursuant to the motion adopted on Monday, May the 4th, 2026, the committee is meeting on homelessness in Canada. Today's meeting is taking place in a hybrid format pursuant to the standing orders. Members and witnesses are appearing in person in the room and remotely using the Zoom application. Before we begin, I would wish to remind all members, please silence your devices, whatever you have with you. As well, you have the option to participate in today's meeting in the official language of your choice. Please use the earpiece and select a channel that you wish to participate in that language. If you're appearing virtually, please click on the globe icon at the bottom of your surface. Choose the official language of your choice. If there's an interruption in translation services, get my attention. We'll spend while they are corrected. All those appearing have met the required test to be translated in both languages. As well, please refrain from tapping the boom on the microphone for the protection of our translators. I would like to, as well, please direct all comments through either chair. Wait until I recognize you by name before proceeding to speak. I would now like to welcome our witnesses for the first hour. From La Halte du Coin, Pierre Rousseau, Chief Executive Officer, yes, in the room. And Frédéric Favreau, oui, a Clinical Director. From RAFT, Michael Lethby, Executive Director. And from Tiny Homes, Ryan Donas, a Founder and Executive Director. Each witness, one speaking for a group, will have 5 minutes for your opening statements. We will begin with who's speaking for La Halte du Coin. Monsieur Rousseau?
Oui, alors.
Monsieur?
Alors,
for 5 minutes, please. We will be sharing our time with Ms. Favreau. Well, it's very difficult to present our entire mission and the issues related to homelessness associated with federal programs in 5 minutes. Here are some elements that may support our presentation and we hope prompt clarification questions. My name is Pierre Rousseau. I am the General Director of La Halte du Coin since 2023. We'll explain what our association is about. I retired from the Montreal Police Service where I served for 30 years. I was in charge of training for Quebec Police Services, and I graduated from École Nationale d'Administration Publique, and I used to be an administrator of the VCS program for 2 years, and I worked at the mental health program there before starting to work in homelessness. My name is Frédéric. I'm the Clinical Director with La Halte du Coin. I studied criminology. I worked for 2 years at the Public Safety Department and in detention facilities in Montreal, and I've been working in this field for about 11 years. Well, La Halte du Coin is a safe emergency shelter for people experiencing homelessness. We have a high level of accessibility. We work in emergency settings, and so we do some things differently. We have some programs and projects, for instance, the ECHO project for accompanying individuals who follow trainings, then to go on and help their family members. We also have extended emergency program for cases where we work with our partners, and we accompany people until they have access to accommodation or therapy or other services they might need. We also have the FIT program, which is a federal program. It's a structured program for individuals with mental issues, mental health issues, and addiction issues. We also have a local medical clinic, so nurses and physicians who work with La Halte du Coin to help individuals experiencing homelessness in terms of their different needs. And then since we don't have a day center, we open our doors to all people who are in a vulnerable situation if they need services, hygiene services, or if they need access to food, for instance. In terms of some of the stats, since 2020, we have been facing ever-growing number of requests. We have been welcoming new faces. So from April 1st, 2024 to March 31st, 2025, we accommodated more than 887 different people for a total of 16,612 accommodation requests, with about 3,000 requests being refused, an average of 9 people per day. And between April 1st, 2025 from April 2025 to March 31st, 2026, we accommodated 964 different people for 19,000 nights, and then we refused 5,000 requests, which is an average of 15 people per day. So, but we increased our capacity, and even though that was the case, we ended up doubling the number of refused requests. So needs are ever growing since early 2020. Now, I worked within the framework of Reaching Home, and I've now been the director for 3 years. So I have some comments about the Reaching Home program. Now, I'm not going to take too much time because we only have 5 minutes, but we will be happy to answer any questions with regard to how the program is flexible and the predictability that is necessary. That's it. Thank you, Mr. Rousseau and Ms. Favreau.
Now, Mr. Lefby. Lefby. Oh, thank you. Lefby for RAFT. You have 5 minutes, Louis.
Thank you, Chair, members of the committee. Thank you for your invitation to appear today. My name is Michael Lefby, Executive Director of the RAFT, a youth serving organization in the Niagara region. It's likely no surprise to the committee that homelessness has been increasing across Canada, and it's been reported that instances of homelessness have more than doubled since 2018, with many smaller communities seeing visible homeless in their streets and parks for the first time. My first-hand experience in the homeless sector occurred in the spring of 2005 when, out of the cold, a volunteer-run overnight shelter closed after winter. Unlike other years, the residents of the shelter banded together and occupied St. Catharines Montebello Park. This group, which called itself a Ray of Hope, had one demand: that the municipality open a year-round shelter. The city sought a temporary accommodation by opening a shelter in unused city property. I was selected to manage the shelter and work with the Ray of Hope leadership to find a resolution. The solution was a request for proposal issued by the municipality to open and operate a year-round shelter. At the time, this did seem like a solution. It resolved an immediate crisis in a fair and respectful manner. What we didn't understand was that we had started a process of increasing homelessness in St. Catharines and Niagara. In 2006, I became the Executive Director of RAFT, a 10-bed youth shelter in downtown St. Catharines in a dilapidated building. This building was in such poor shape that none of the doors closed, including the only bathroom, and was so infested with rodents that we would find their bodies throughout the building. Yet, even in such a state, our shelter was full every night, and I was forced to turn away youth. The solution, which I'd already experienced, was to open a new, larger shelter, which I did in 2007. The new shelter was and remains beautiful. 24 beds, large rooms, proper showers and bathrooms, full kitchen, all the doors closed, no rodents. Within a couple of months, the solution was overrun. All my beds were full, and I was back to turning kids away. I'm telling you these stories because I wanted to establish for the committee that I was part of the problem. The solution to homelessness was opening more shelter. This solution entrenches homelessness, creating a vicious cycle of homelessness which leads to expanding shelter, which leads to increasing homelessness. I know this is true because I both witnessed it and have participated in it. In 2006, the RAFT sheltered 120 individual youth. In the years 2007, 2008, the new shelter saw these numbers increase to almost 500 per year. Not only was the shelter entrenching youth in St. Catharines into homelessness, but we'd also started pulling youth from the smaller communities and towns. But here's where the story changes. I didn't open a 35-bed shelter or a 50-bed shelter. Overwhelmed by demand and lacking any ability to increase supply, I started considering how to reduce demand. What I found was that the majority of my assumptions about homelessness were wrong. For example, I found that the majority of kids accessing my shelter were in high school immediately prior to becoming homeless, and that for many, they had dropped out of school in order to access shelter. These weren't bad kids. However, once in my shelter, few returned to their schools or their communities. Instead, for many, they had found a new community in homelessness in the street. In 2013, Youth Reconnect was our solution was a program called Youth Reconnect, a simple program which works with teachers to identify students who may be struggling with housing. Once identified, a RAFT worker meets with the student to understand the struggle and works to develop the solution. This approach was instantly successful. Students remained housed in their community, remained attached to their schools. Importantly, they remained attached to their natural supports. In 2013, Youth Reconnect was available to every student in Niagara. That year, RAFT Shelter went from sheltering close to 500 youth per year to 160, which represents a 70% reduction in youth homelessness. Since then, RAFT has expanded its prevention and diversion programming, adding shelter diversion and dedicated family and natural supports. As a consequence, homeless youth are only 6 to 8% of the homeless population in Niagara. In 2024, the other youth shelter closed due to a lack of demand. RAFT is now the only youth shelter. We have an average of 3 to 4 kids per night in a region with a population nearing 500,000. One shelter, 4 kids. Achieving this solution requires recognizing that homelessness is caused by impaired relationships and social exclusion, an unwavering focus on housing, including the recognition that family is Canada's largest provider of affordable housing. Offering fully funded, proven prevention and diversion programs, and increasing the productivity of shelters by reducing lengths of stay and increasing successful discharges to housing. Thank you.
Thank you, Mr. Lethby. You gave a much different perspective than I've heard in some time on this issue. Not to take away from any of the witnesses, but thank you for presenting. Mr. Donas? For 5 minutes.
Good afternoon, Chair and members of the committee. My name is Ryan Donay, and I am the founder of Tiny Tiny Homes, a charity organization focused on transitional housing for people experiencing homelessness. I also come with lived experience. I first experienced homelessness at 16 while still in foster care. Over the next 10 years, I spent that time on the streets, in and out of jail, and stuck in a cycle of destroying my future. What I needed most was not just a shelter bed. I needed stability. I needed privacy. I needed a safe place where I could focus on rebuilding my life. When you're stuck in survival mode every day, it's hard to work on addiction, trauma, employment, education, or mental health. Housing creates a foundation for recovery and stability. That experience has led me to create Tiny Tiny Homes. I believe that healing begins with housing. One of our residents, Brent Blake, was living with stage 4 cancer. He was the nicest guy in the world, humble, proud, and the type of person who would not accept $1 from anyone. He also wouldn't go to a shelter. We were able to get Brent inside of a tiny home and then into permanent housing for the last few months of his life. We offered him something the system couldn't, a path back to his own dignity. So one thing I would like the committee to understand is that homelessness is not a one-size-fits-all. Different populations require different solutions. While tiny homes are where we started, we believe it's only a small part of the bigger picture of housing. The real goal is creating pathways out of homelessness through a multi-level approach of stable, affordable, and supportive housing. In Toronto, we currently have tiny homes operating, and we are working on launching another larger location this summer. And one of our major projects is a 10-unit youth housing development in Chatham, Ontario, focused on youth exiting foster care and youth experiencing homelessness. These young people are at extremely high risk of chronic homelessness after aging out of care. Our goal is to provide small private units with washrooms and supportive services so these youth have a stable foundation while they transition into adulthood. All the projects are funded by grants and donations. No funding has come from government. From our experience on the ground, I believe there are several areas where the federal government could improve outcomes. First, funding processes need to move faster. Small organizations often struggle with long approval timelines and complex application systems, even when projects are ready to move forward. Second, there needs to be more support for smaller, community-led housing models. Large projects are important, but smaller projects often can be built faster, integrated into communities more easily, and operated with lower costs. Third, we need to focus on transitional and supportive housing, especially for vulnerable populations, like youth exiting foster care, people recovering from addiction, seniors, and people leaving encampments. I also believe that we need to recognize that harm reduction starts with housing first. It is next to impossible for someone to recover from addiction, improve their mental health, or stabilize their life while living outside in survival mode every single day. Housing gives people the stability needed to begin working on the deeper issues they are facing. In Toronto, the average cost of a shelter bed is about $136 per night. And in specialized shelter settings, the costs are significantly higher. On a most basic level, it is often cheaper to house people than to keep them homeless in emergency systems. But beyond the financial cost, stable housing also reduces pressure on hospitals, policing, emergency services, and the justice system. Housing creates stability before crisis happens. At a time when every public dollar matters, we should be prioritizing housing models that deliver the greatest number of housing outcomes per dollar invested. By embracing a lower-cost housing solutions, we can help more Canadians without increasing overall spending. And finally, I believe we need to remember that housing is not just infrastructure. Housing is healthcare, housing is prevention, housing is public safety, and housing is dignity. Everybody deserves a safe place to stabilize their life and build a future. Thank you very much for the opportunity to speak today, and I look forward to your questions.
Oh, thank you, Mr. Donay. Have I got Donay? Got it right now. My mistake at first. Thank you so much for your testimony. Interesting in the question round. Mr. Aitchison for 6 minutes.
Thank you,
I'd like
Mr.
to
Chair.
change with you, but I can't.
We'll give you an opportunity. You can exercise your prerogative a little later on. Thank you to all the witnesses who are here today. We appreciate you coming. And I'm going to start with Mr. Lethby. You and I have talked a few times now about what I think is quite a miraculous transformation of the youth homeless situation in Niagara. I'm wondering, though, if you can explain to us a little bit about the homeless and the shelter system generally, and how we find ourselves in a situation where you found yourself, for example, where politicians seem to think that the solution is more money for more beds, and that's the solution. And I wonder if you can just elaborate on that a little bit for committee. Basically tell us what we've been doing wrong.
Yeah, thank you. Thank you for the question, the Chair. I mean, this is not, this is a solution that's over 100 years old. I was over in England not too long ago, and I found that there was a shelter that was created for people coming in order to work in the cities. And so this has been our response. What's happened is our society has changed over time, and our response has stayed largely the same. In the past, people would come in, it was mostly men, and it was very temporary stays. What's happened now is we have a shelter system that's trying to deal with all the population, utilizing a model that was really designed for another time. And from a politician's standpoint, especially as a mayor, mayors tend to be the politicians who hear about homelessness the most. They're the ones taking the calls because there's someone downtown. These are, and so the answer that tends to be, and it's very understandable, you see someone on the street, you assume they need a place to go. And so shelter seems to be the logical in-between place, because we all know housing's unaffordable. Although I'll say that I've been doing this work for 20 years, and housing's always been unaffordable. I've never been at a time where housing was affordable. But the same answer comes through, and then it's only being reinforced now by courts, which is saying, well, the answer to homelessness is you must provide, like the direction to municipalities is you must provide shelter. So we're even further entrenching shelter into our system from a legal standpoint, which makes it then very difficult to look at other options.
What's I want to just continue with this line of questioning then. You focus very much on diversion, so diverting young people from ever becoming homeless in the first place. We've heard a stat in the last meeting that there's a staggering number of people experiencing homelessness as adults whose first experience with homelessness was before they were 24 years old. And so the work that you are doing now is not just about the young people today, but it's about the future. And so I'm wondering if you can speak a little bit more about that work and about what the biggest barrier is to diverting people from becoming homeless in the first place.
Thank you for the question, through the chair. Yeah, so actually I had conducted a research study in 2006 where we did an interview with about 160 entrenched homeless in the Niagara region. About 45% of that population identified that they were first homeless as a teen. And so we have very local research that showed this from, and actually it was part of the development of our program was that study back in 2006. The biggest barrier, I think, one is that so prevention takes time. That's probably one of the biggest barriers. So if you're the mayor and you're getting all those calls, it's hard for someone to stand up and say, well, we have a solution, but it's going to take 5 to 10 years to have effect. And that's sort of the tough part about prevention, is that it's generational. It takes time before it affects, in which case you have to have both your shelter emergency system running at the same speed as you're running your prevention. And that tends to be because it's in a crisis moment and people tend to want to deliver crisis services. And so it's always hard to sort of champion a prevention model which doesn't directly address those. Although we have found with our our shelter diversion program, this program is probably the best of the early adopted prevention programs, because we're seeing currently a 70% chance. If you've never been in shelter before as a young person, 70% of that group were able to divert to safe and appropriate housing. And if you have had experience with homelessness, and we're still seeing a diversion rate of about 40% for an overall diversion rate of about 53 to 59%.
I have 40 seconds left here. Someone's talking about me back there. I want to make sure that we don't demonize very well-meaning people who see their raison d'être to grow their organization and house as many people as possible. I think that's very well-meaning, but you're telling us it's not really the solution.
In my experience, it's not the solution. In my experience, we look at housing and we look at boxes, and I see families.
Thank you.
Thank you, Mr. Aitchison. Monsieur Joseph, pour 6.
Mr. Joseph, for 6 minutes. Thank you, Chair. I would like to thank all the witnesses who are here, and their contributions in this study are very valuable. Now, I'm going to ask a question to Mr. Rousseau. As a professional who has previously been in charge of administering Reaching Home programs, in your opinion, how can we improve this program? Well, the program is very comprehensive. It covers housing search as a process, and all kinds of other things. What's a challenge for organizations is, for instance, late announces, because Reaching Home is a major source of funding for people in Quebec, in addition to the Quebec government's PAII program. So if there are reductions, of course, that has an impact in terms of how we're running our operations and on the staff we can retain. So if it's possible, we would appreciate advance announcements with regard to these programs being extended. Now, reaching home, of course, as important as it is, it needs to be a recurring program with projects every 2 years. Now, of course, there are important management rules that needs to be respected. Otherwise, we end up losing associations active in this field. For instance, being able to roll over amounts from one year to another. That would be an amazing improvement, and it would also allow organizations to better manage their funds, because we have some amounts that are announced in February, and you need to spend them by March 31st. Well, we invest these funds, we end up buying things, but if we are able to roll over these amounts, that gives us more predictability. And when I was running the Reaching Home program, this became an issue for us, because you need to find entrepreneurs for a project, and it's too rigid in that sense. So the late announces, and if we can have an advance notice of these amounts, and in order not to have to come up with last-minute projects and to be able to spend the money we have that needs to be spent by March 31st, let's say. So in that case, we would be able to do more. Again, shelters work with people who are in camps, and we actually had something under the Jacques Cartier Bridge. So it was a whole sea of people who were there, and we have been getting more and more people coming in to take advantage of our services. Now, we work with many organizations when it comes to the transitioning these people over the 6 to 12-month framework. We increased our beds from 30 to 45, but we still ended up doubling almost the number of refused requests. So, of course, I welcome the investment from the government, which was injected into Reaching Home, but we need to do more. With extended emergency programs, we're able to take people off the streets. In October, we had a program with 105 people who are trying to build something for themselves. We need to give people more time. I have another question for you. Do you think that more predictable and more flexible funding would allow associations to be able to offer more direct services and not focus so much on admin management? Of course, we have to have good management. If we don't have predictability, that is a big hindrance, because we need to make investments and we have expenditures. But with last minute information, we simply cannot keep up. Mr. Chair, if I have time, 50 seconds. Okay. Ms. Favreau, if you had 3 priority recommendations to provide to the committee for this study, what would these recommendations be? Well, I think the first thing is really investing in prevention. This is the outcome of many studies. Pierre also says that we need to really invest in prevention. We also need to invest in camps. For instance, in Longueuil, we have some of these spots, people living by the roadside, so they need more resources and more time. for, and then housing, but supportive housing, not just housing for housing's sake. Without any supporting services, just putting them into housing units, that doesn't really fix the problem. Thank you, Chair. Thank you, Mr. Joseph. Ms. Larouche, for 6 minutes. Thank you very much, Mr. Chair. I would like to thank our witnesses. Mr. Lethby, thank you for your point of view on this matter. It's very interesting and different. Mr. Donnet as well. I will ask my first couple questions to La Halte du Coin, Ms. Favreau, Ms. Rousseau. Thank you very much for being with us today. I actually don't even have a question in terms of the shift that you have observed. You have doubled the number of rejected requests, even though you increased the number of beds you had. Now, as someone who represents the region of Grand Bay, I can confirm that the same thing is going on over there. It's a real big issue. It's not just a Montreal issue. So the faces are changing. So my first questions will have to do with that. You spoke about an increase in numbers, and Mr. Rousseau, you also talked about seeing new faces. Now, beyond the numbers, who are these new people who end up experiencing homelessness? Well, it's very diverse. I worked in Montreal. I patrolled the poorest neighborhoods of Montreal. There's, of course, gentrification going on. We used to have people who were having a hard time at the end of months, for instance. But then we had, of course, a whole slew of evictions with units being renovated. So some of those people got organized who were on social assistance. I think it was $865, but even the room is $1,100 in some cases. So there's that. We have seniors, a lot of seniors. When they are at the shelter, when they are at La Halte, they might be because of a family situation. So senior citizens who can no longer pay for accommodation, 93-year-olds, or youth coming out of youth centers, which we try to refer to different organizations in the meantime, because of course we want to accept people, but we have more youth, more seniors. There was a couple, there was an individual with a visual handicap who had someone accompanying them. So that was simply unbelievable. It's quite surprising. I don't know if Frederick would like to add. I think that covers it. We have renoviction victims, if I can put it that way. So that's something more recent. That a group of people we have started seeing. Well, in Grand Bay, there is a local association that's really fighting on that front to fight against renovictions. And last Friday there was an interview, well, Thursday rather, as I was going back to the riding. Now, you were talking about social assistance, but all these programs and social assistance, even combined together, sometimes senior citizens are having a hard time paying rent. And then there's all the youth centers. So yes, we can clearly see that the faces have been changing. Canada Food Bank also published a report recently. I was just trying to see who are these new people who are asking for support from food banks. Because, of course, we have the highest inflation in housing costs and groceries. So people are clearly having a hard time on both fronts. So you spoke about insufficient income. Is it also a lack of wraparound services or a lack of funding? Because you spoke about reaching home. In January, I had contacts and discussions with a couple of organizations from my region. Now, a lot of organizations actually were benefiting from some of these programs, which are now being sunset. Well, of course, there can be many causes of leading people to homelessness: separations, accidents, addictions. So it's quite diverse. You spoke about food banks. People come and see us for that reason as well, because they simply cannot afford food. And that's where people start to need these services more and more. So we increased our bed capacity. This year, despite the financial injection we had from an association, we will close the year in the red. So thank you for the effort. Thank you for all that's been done. But unfortunately, it's not sufficient. And we see that in the numbers every day. I had a meeting this morning, actually, but we don't have the final confirmed numbers. And our organization, we had a project around metro entry and exit points just for the winter time. So we are already thinking about the next round of similar projects if new amounts are not sufficient or if the funding is not renewed. So all these people have gone to their usual spots in Longueuil, where you can expect to find them, in camps. So it becomes harder and harder to bring these people back into society. Thank you, Ms. LaRouche.
D. Ritter? D. Ritter?
Yes, that's right. Thank you, Chair.
5 minutes, ma'am.
Thank you.
And welcome. We got a number of new members this morning, or this afternoon.
I'm going to start with you, Mr. Donis. Thank you for coming and sharing your story. From one person who slept on the streets to another, the more people who talk about it, the more we'll make change in this country. I'm grateful for your courage and for you wanting to have a solution to what we're seeing here in this country. One thing I think that we haven't focused on yet today is how addictions is surrounding in homelessness and how it's a piece of the puzzle of what we're seeing in the country today. I know I have an encampment in Kitchener that was just ruled that they're going to stay because the housing needs to be provided, which you said is stifling progress. I agree with you, sir. But our office went and talked to 22 of those residents in that encampment. And of those 22, only one wasn't using. So I think a piece of that is recovery services, addiction, and focusing on your big, beautiful life on the other side of addiction. So can you just speak to how that transitional piece will help with focusing on recovery, stabilitization, and recovery for people trapped in addiction?
So I think for me as well, addiction definitely played a part in my homelessness, and recovery was a big part of ending that cycle, getting out of that cycle. I think the solution is not spending more money. I think if we spend money differently and we divert it towards the places it should go, there's a lot of seniors who just need a small rent supplement. If we spend money differently, we can divert money towards more things like addiction services. Right now, if in any major city in Canada, if you were to call whatever city services and say, hey, I want to go to rehab, those are months away. We need more wraparound supports, and we need more pathways towards, ending the behavior that causes homelessness.
Agreed completely. Mr. Lethby, can you just speak to how many, when we're talking about youth, because you spoke on youth today, when they're entering homelessness, how mental health, addictions, family breakdown, or social isolation becomes a part of that? And if we would just concentrate on upstream funding more, how we'll break those cycles before these youth fall into addiction themselves?
Yeah, thank you, through the chair. There's a famous study in World War II where they looked at planes that survived, and they saw where the planes had taken damage. And then they assumed that they needed to strengthen these parts of the plane, but in fact, that's the opposite. It's the planes that didn't survive. These were the planes that survived. And so similarly, in homelessness, we see lots of addiction, lots of mental health, lots of poverty. But we're not actually seeing all the people that didn't become homeless. So if you look at addictions, serious addiction in Canada is probably 16%. And so if homelessness is roughly 1% of the population at any given time, we would expect that if addiction was a major driver of homelessness, that we'd expect to see a lot more homeless. But we're not. And so that's part of the so why. That's the question. And what I find is if we take, and I call it the unifying theory of homelessness, it's your people are homeless because they're an inability to leverage a social relationship for housing. And so why are people with serious addictions not flooding our streets is because they have family and they have friends. And they go out of their way to make sure that these people are housed. And so the people that we see on the streets are people where, for some reason, they have not been able to access those supports. And so the work we do is recognizing that and seeing how can we support people to better their relationships and then allow the system, the natural system, not the for-profit paid system, to support people through housing.
Thank you. Not 100% of the cases they didn't have supports. I had family who loved me very much, but showed me tough love. And while I was in active addiction, I wasn't allowed home. But when I was ready to cover, I was. And so that's a piece of it, I think, as well, moving forward. There's some people who fall in, because it was fun in high school, and then it just turned into something that they didn't ever expect to happen. And so we need to support anybody who wants to recover and who needs to recover at any given moment that they want to. Can you just attest to, if you were to make the decision today, how fleeting that decision is and how quickly we need to respond as soon as someone says that they're ready? Mr. Donis.
We need to set people up for success. Recovering from addiction, it's not just going to treatment. It's going to detox, waiting to get into treatment, going to treatment, and then the housing aftercare after it. If you've been in active addiction for however long you've been, you can count many times that longer to unlearn that behavior. We need to put more supports in place, not just for addiction, for mental health. We need to support people to end the cycle of homelessness.
Thank you.
Monsieur de Ritter, Madame Romanado, pour 5 minutes.
Merci beaucoup, Monsieur le Président.
Thank you very much, Chair. And I would like to thank all the witnesses for being with us today. I would like to thank first off Mr. Russo and Ms. Favreau as the MP for the other Longueuil. So I know about the work that you have been doing around the Jacques-Cartier Bridge. I'd like to begin with you, Mr. Russo and Ms. Favreau. You spoke about prevention a little bit, but also the importance of having housing, but all of the services, the wraparound services. When I was elected in 2015, one of the first questions, or one of the first meetings, rather, I had was with an association working in this field. I mean, in the South Shore, homelessness, this is impossible. Everyone's doing well. How is that the case? But they spoke to me about problems with the lack of ecosystem. For instance, if a person is having an addiction issue or a mental health issue, if they are having family problems, if they're not being accompanied, if they don't have the wraparound services available to them, and if you cannot offer them a place to live, well, if the support is not there in that case, well, could you share your recommendations when it comes to accompanying such an individual who is experiencing homelessness? Because it's not just a question of them not being able to find affordable housing, for instance. There's a whole system around. Could you share your recommendations with us? Of course. Now, there is a ladders and snakes game that maybe some of you played as a kid. So homelessness, for some people, it's a first step or first stage. Maybe they will take a ladder. But for shelters, you need to be open to welcoming all these kinds of people who are at different steps and stages. Of course, housing with support services, it's super important. But we are faced with a significant number of people who are experiencing chronic homelessness. It's quite sad to see. In the Longueuil region, we have different organizations. We work really well together as a team, but if La Halte du Coin, if we're one piece of the puzzle, and then if you have a continuum with housing and services, etc., now in that you have the ECHO project or Extended Emergency Situations project for people who are needing to build something. And we had, for instance, in October, a project with 105 people, 65 of whom were receiving therapy. So there is no magic solution. You need to adapt. And it's frustrating in a way because there's also fatigue that sets in. But you have to respect that continuum of where people are. You cannot put everyone into housing as a magical solution and then that's the end of it. They need to be accompanied. There need to be wraparound services. And some will still trip and fall and then get back up. But you need to build relationships of trust. We know the people we work with and we are building bridges with them, that we are starting something. And then with projects such as ECHO or other projects with the Department of Social Solidarity and Labor. For instance, we offered training through the Quebec Association for Social Readaptation, and then people speak about their experiences, then they're integrated into training programs to come back and work in this domain. Now, it's very hard to answer that question because people are all in all kinds of different situations. I took a lot of time, I'm sorry. I would like to ask a question to Mr. Leth.
A little bit about a success story in terms of youth and prevention and keeping kids out of homelessness. I'm assuming that you've had to work very closely then with municipalities, with schools, with teachers, with social workers and so on to successfully implement that program. Would you recommend for those who are trying to do similar work in terms of we hope one day we don't need shelters, but is your hope that it's all levels of government, all I don't know the word in English, intervenant, working together for that common goal to say we have somebody at risk right now. Let's make sure they don't get to the point of being homeless. Could you give us any insight?
Yeah.
Real short.
Yeah, 100%. We've had to work with the whole community in order to support the youth. So it's not something that my agency can do alone, but I do think it's important that all the services focus on the thing that they do well instead of trying to do all the other things. And that's where I find there's some conflict. So we focus on youth and on making sure they get into housing.
Merci, Madame. Madame LaRouche, pour du...
Ms. LaRouche, for 2.5 minutes. Thank you very much, Mr. Chair, once again. Dear witnesses, you are the unspoken heroes because with your day-to-day work, you're changing people's lives. And some of you, after having had tough experiences in your lives, so just wanted to highlight and acknowledge that. Mr. Rousseau, you were speaking about the reasons which might lead people to experience homelessness. A divorce, for instance. Now, as a teen, actually, I was part of this social activity. We were serving people meals, and I got to chatting with someone who used to be a lawyer, but following a divorce, they found themselves on the street. So it is true that there are multiple reasons which might lead people to the street or to experiencing homelessness. So, Mr. Rousseau, Ms. Favreau, there are many Quebec organizations who are asking for a continuum of services approach. Now, having a one-size-fits-all housing solution, for instance, doesn't really answer the needs of everyone. In my region, there are many associations that also speak about the steps on a ladder. So it's one step at a time. But if you're trying to skip a step, you might end up falling back. You referred to ladders, snakes and ladders as a game, same kind of imagery. But what do you think about the housing offer? Well, there's such a variety of people who are experiencing homelessness that it's tough to say. Some of them have been with shelters, or some of them have been able to get into accommodation, but it's not always the case for everyone. You don't want to see more and more people lining up in front of a shelter. Of course, it takes housing, but with services added to housing. And when people are at that point, it's very hard for them, and sometimes they have to wait for a long time. Some have been waiting for 3 years, so it's very long. For some others, it's not the case because they still have a bit of a network left. They are able to get back on their feet rather quickly, and we are able to support them. We know their names. We have relationships with them. They do better. But, of course, Ms. LaRouche, housing is not the only thing, but it's important to have. And people experiencing homelessness, they make up a community. Thank you, Ms. LaRouche.
For 5 minutes, Mr. Davies.
Thank you, Mr. Chair. Mr. Lethby, I want to start by saying how much I appreciated meeting you about a week and a half ago, I guess it was, and going to RAFT. As a resident of Niagara, for those around the committee, Niagara is comprised of 12 municipalities. RAFT is in the city of St. Catharines. And as a youth homeless shelter, what is the profile? What is the typical profile of someone who would come to your facility?
So typically, it would be a young person between the ages of 16 and 24 looking for shelter. There's a large percentage of the young people that would have had a history of care at some point, probably about 40% of young people coming into my shelter have been somehow in the system. The other side, definitely addictions, mental health would be a factor. Moving out on their own, not knowing how to deal with a landlord, or even being able to start the process. So just not understanding how to engage the system properly, those would all be characteristics.
So in a region like Niagara with so many municipalities, we tend to exist in silos in Niagara, and we had this discussion. How is it that people, for example, from Port Colborne or Fort Erie or Wainfleet could actually find their way to your shelter? It's quite a distance.
And actually, that was one of the things I had found when we first, so back in 2007, when we had that 500 youth coming, when I looked at who was actually coming, we assumed that the majority were from St. Catharines. But in fact, 60% or more were actually from all the communities around St. Catharines. And what we had found at the time most troubling is that this group of youth was particularly vulnerable because not only were they vulnerable from their experiences of homelessness, but they were vulnerable because we were forcing them to travel to St. Catharines in order to access. And at the time, I called it the bus station challenge. Anyone could go to the bus station and watch the out-of-town bus, and you can tell when someone coming off that bus is not from the city. And what was happening, though, is that not only I had no outreach, but drug dealers and pimps did. And so they would wait at the bus station, and they'd wait for those kids to come off a bus, and then they'd bring them in, and they'd say, you need a place to stay? You want to smoke? And we even had examples of gangs enrolling students in high school in order to bring drugs into that school or recruit for human trafficking. So So that's what happened, and that's why when we started Youth Reconnect, that's what was so successful with that program, is that we were able to keep kids in their community so they never had to travel to receive service, and we didn't force them to become vulnerable in order to access service.
So one of the biggest issues that I have encountered over the years has to do with the right of people to maintain their privacy. Kids who are facing difficulty, who are in a shelter, have the right to say, I don't want my parents to be involved. They have the right to deny access. Communication, as you try your diversion program, you rely heavily on family, on friends, on school. So we're in a situation in Niagara where if somebody's a fair distance away and they say, I don't want my parents to know where I am, you don't have the right to make that call, correct?
Correct.
And how often have you encountered that, and what specific issues, and what are the challenges in dealing with that?
Yeah, it definitely is an issue. One of the first things we ask through shelter diversion is, who are your family, who are your people? Sometimes it's, for about 65% of youth, we found that family conflict is largely what's driving youth homelessness. So if you ask the youth, why are you coming to the shelter? They say somehow it breaks down to ultimately a conflict with family. But what we also found is that there still is a drive to be attached to family and friends. That's still their community. And so sometimes it's a matter of just giving people a bit of time and sort of saying you're safe. Regardless of what happens, you're safe. And if it takes a week, maybe then we can re-engage and see if there's, and then family's much larger than just a couple people. Like when we talk about family and friends, we're talking about your entire community. It could be a grandparent, could be a cousin, could be an elder sibling. So when we're asking for permission to speak to family, we're really looking beyond maybe someone you might have the immediate conflict with to that much larger group, especially in rural communities where families tend to be larger in physically placed.
So I know we only have about 10 seconds left, but one question on related to access to parents and sharing of information. Can you recommend a solution to us? What do we need to do to fix that so we can get more help and get more of our youth in better facilities?
I don't think I have anything to really offer on that. I mean, I believe in privacy. I think people have a right to privacy, but it's how we approach the question, I think, is important from a service side.
Thank you.
Thank you, Mr. Davis. We'll conclude with Mr. Saini. Mr. Saini, for 5 minutes.
Thank you, Mr. Chair. Thank you to all the witnesses. It's very heartbreaking that we hear the stories, especially living in a country that we live in, and it's sad it happens. My question to you, Mr. Lathby, you said a lot of the people are coming as youth. Is it family breakdown? Is it a cultural issue? What are the issues? What are forcing these kids to be in a situation where they are?
Yeah, through you, Chair. So it really is legion, the number of issues that kids are facing. I mean, as I mentioned, largely 40% we know have had experiences in care. So, I mean, if you're going to look at the single sort of largest risk factor someone may have, it's if they've had a history of care is definitely one of them. And then if you think about it, again, through my social lens, when you've been taken into care and especially protection is so mandated, the system tends to block you from family. Because family is seen as the danger that you need to protect it against. And although this is changing, definitely for the kids that are coming through, so it's like prevention is generational. A change made now is 25 years before we start to see the effect of it. And so that would be the number one reason. But at the core of all of it is family break. It could be as simple as I'm not following the rules. Maybe I've started going to school, and maybe I've started smoking pot in my room. All the way up to the most horrific abuses you could possibly imagine. And so when we talk about family conflict, we really do have to look at it from a nuanced perspective to see, is it the most horrific, or is it something that we can maybe have a little conversation between the two of you, the parent and the child, to say, okay, maybe there's some rules we can follow and sort of work it out.
Thank you. My next question is to Mr. Donis. Looking at the data, it shows a high proportion of homeless youths are from LGBT communities. In keeping with your experience, what are some of the unique challenges facing this population?
I don't have a lot of experience in that, so I wouldn't be able to talk much about that question. So, yeah, sorry. I don't have a lot of experience in that field.
Could any of the other panelists have any experience in this?
Ben, nous, à la halte du camp, on accueille des gens.
Well, we welcome people from all kinds of circles, but we don't necessarily have any expertise in that sense. But they might be subject to more stigma compared to some others. Maybe, of course, we offer them the same services, but we don't really have expertise per se. We don't have an extremely high number of people from this community either.
The committee has amended to make some recommendation. What would be the 3 things you want this committee to take it to the government of Canada and say, look, we need to help these people. This is how we can go forward. Maybe Mr. Lathmy?
Thank you. So 3 things. First one, I think that the critical piece that families in Canada are affordable housing, and a housing strategy that doesn't include the largest provider of affordable housing is destined to fail. So that would be my first. Second one, we need to start actual prevention programs. We've researched programs. We have a large body of knowledge now. We need to start actually implementing the programs with time for research. It needs to continue, but we need to actually start doing. And then finally, we need to start increasing the productivity in shelters. We need to look at how shelter operations, and we need to start seeing reduced lengths of stay and more success to housing. So we can no longer allow for an unproductive system.
Thank you, Mr. Chair.
Thank you, Mr. Saini. That concludes the first hour of this meeting. We'll suspend momentarily while we transition to the next hour. And thank you so much to the witnesses that appeared. Your testimony was extremely informative for this study. So thank you, and we'll suspend for 3 minutes. Suspend. We are back in session, and all our witnesses are virtual?
Yes.
Are virtual for this last hour. I would just briefly remind those participating online, you have the option to participate in today's meeting in the official language of your choice. Choose, click on the globe icon at the bottom of your surface and choose the language you wish to participate in. If there is an issue, please get my attention. We'll suspend while it's corrected. As well, please direct all questions through I, the chair, and wait until I recognize you. We'll begin with 5-minute opening, up to 5-minute opening statements with each member. We have Maxime Rainville from Corporation de Développement Communautaire de Brome-Misquois, and Cédric Champagne, Entrée chez Soi Brome-Misquois, and Sheldon Paulette from Raising the Roof. We'll begin with Monsieur Rainville for 5 minutes. Monsieur Rainville.
Oui, bonjour.
Yes, hello. My name is Maxime Rainville, and I represent the Brome-Missisquoi Community Development Corporation. So the corporation is a multi-sectoral coalition of community organizations. We have 60 active members in this corporation. And the CDC, the acronym we use for our association, it ensures the active participation of the independent community action movement in the socio-economic development of its community.
I'm going to ask you to stop. There is a sound issue. I will correct it. I'm going to move to Cédric Champagne for your opening 5-minute statement. Mr. Champagne, we'll get back to you, Monsieur Rainville.
Parfait, merci. Monsieur le Président, Mesdames les...
Okay, thank you, Mr. Chair, Vice Chairs, members of the committee. Good afternoon. First of all, I would like to thank you for the invitation to appear that you sent to Entrée chez Soi Brome-Missisquois. A special thank you to Mr. Villeneuve, who is an MP, who's the MP for our riding. Our organization's mission is to support people living with mental health challenges in their own communities. We promote our members' independence and support their ability to take action. We define ourselves as agents of social change and hope. It's in my capacity as director of this organization, but also as a daily witness to the humanitarian crisis unfolding on the ground that I address you today. Homelessness is no longer an exclusively urban phenomenon. It is now hitting our regions, our MCRs, and our rural communities with full force. To address this, we must adapt our tools. Now, first off, Reaching Home program, it has successes, but also blind spots. It is one of the best federal programs of recent years. Its flexibility is remarkable, and it allows communities to collaborate and target their own priorities. Above all, by not imposing the criterion of innovation at all costs, it allows for the continuation of structural projects that support people over the long term. However, its main shortcoming lies in the division of funding between designated communities on the one hand and the homelessness in rural and remote communities component. So the ICRE, it would be the French acronym for the second category. My region, Brome-Missisquois, is an ICRE. For the entire S3 region, with the exception of Sherbrooke, the funds received are significantly lower than those of a designated community, but the needs are just as pressing, if not more so. In rural areas, the scattered population and lack of existing infrastructure increase the cost of interventions. We can no longer be satisfied with micro-projects or the distribution of grocery gift cards, which do not provide sufficient structural support. To achieve zero homelessness, we must build sustainable infrastructure. Now, my first recommendation would be to abolish the rigid distinction between designated communities, to revise the distribution of funds based on natural catchment areas and the actual proportion of RCM needs. Now, recommendation 2, it would be to massively increase funding dedicated to physical infrastructure, so the concrete, if you will, which is a major blind spot in current public and private budgets. Now, secondly, housing and support for residential stability. Social and community housing are the cornerstones. In Quebec, the Frappru Association estimates the shortfall at 150,000 subsidized housing units. Here in Brome-Missisquoi, the 2021 census revealed that nearly 20,000 people were eligible for subsidized housing based on their income, for a total of only 665 units that are available in social and community housing. Furthermore, 21% of tenants in our RCM spend 30% or more for their income on housing. The federal government must urgently reinvest heavily in public housing models as it did in the 1980s. But be warned, providing a roof over one's head is not enough. Moving from the street to a closed, fixed, restrictive space is highly anxiety-inducing. Without support, the instinct is to return to the familiar, so the street. Recommendation 3, systematically fund housing stability support services with guidance to ensure a successful transition, just as we provide support for transitions from military to civilian life, from working life to retirement, or even from childhood to adolescence. Solutions must be diverse, so rooming houses, transitional housing, supervised apartments, to respect the freedom of choice of homeless individuals. 3, the intersection of mental health and homelessness. More than 1 in 2 people experiencing homelessness lives with a diagnosed mental health disorder, not to mention undiagnosed cases. Housing is a major determinant of health. The stress of being unable to pay rent causes anxiety. A psychotic episode can lead to eviction. Extreme heat waves with no way to cool off exacerbate symptoms and interfere with medication. It's a vicious cycle. Living on the street worsens mental health, and worsening mental health leads to homelessness. Added to this are persistent prejudices from landlords during viewings and stigma from the neighborhood. So recommendation 4, it's about creating specific and flexible funding pools at the intersection of mental health, addiction crisis, and housing, managed by frontline workers who know the faces behind this distress. The urgency of an intergovernmental truce. Finally, I must address a major obstacle: overlapping jurisdictions and jurisdictional disputes, particularly in Quebec. To receive federal funds, Quebec organizations must obtain authorization under Bill M30. This causes administrative delays of more than 8 weeks if the funding isn't simply held up for 2 or 3 years, while the two levels of government work out their differences. The front lines should never bear the brunt of political friction. Recommendation 5, federal and provincial governments need to enter into a permanent agreement to exempt funds intended for vulnerable populations from the delays caused by Bill M30, and that the federal government refrain from imposing rigid sector-specific conditions, allowing local communities to decide their own priorities. In conclusion, people experiencing homelessness are fully fledged citizens. They have a right to dignity, safety, and hope. Give us the means to act effectively in our communities. Thank you, and I'm open to your questions. Thank you, Mr. Champagne. Mr. Renville, for 5 minutes.
You're on mute, Monsieur Rainville. Yeah. Bon.
OK. Vous m'entendez?
Can you hear me now? Thank you. Well, thank you for your invitation extended to the Brome-Missisquoi Community Development Corporation. So we are a multi-sectoral coalition of community organizations. Our mission is to support, assist, and advocate for the issues, interests, and contributions of its 60 members. So the CDC ensures the active participation of the independent community action movement in the socioeconomic development of its community from a social justice perspective. I would like to begin by emphasizing that for us, there is an inseparable link between homelessness and the housing crisis that is hitting households hard, particularly in the wake of the pandemic. The skyrocketing rise in property values, the increase in the cost of building materials, the rise in rent costs, and incidentally the rise in abuses and discrimination of all kinds against the most vulnerable populations have all weakened the social fabric and made the disruptions in the life trajectories of people who were already vulnerable worse. Homelessness, however, is not merely a phenomenon of housing scarcity. It's also about social disaffiliation in individuals' life trajectories. which is within a social context marked by rising social inequalities, the worsening public services, and the general fragility of populations in terms of mental health. All of our community organizations are affected by this, as are the public services with whom we collaborate, and they are all facing an increasingly difficult workload. The core intervention approach that is favored by community stakeholders regarding these vulnerable populations is based on harm reduction, and it's about welcoming people as whole individuals without seeking to penalize behaviors, but rather guiding and supporting them toward the right resources and best practices to improve their living conditions. While the implementation of financial support measures that promote an intervention and support approach is essential for these individuals, the component related to the supportive environment is also very important. Access to housing, free and universal public services, as well as an affordable basket of goods, all remain essential foundations for enabling a person to live their life with dignity. It's also important to remember that these individuals are full-fledged members of society with the right to citizenship, the right to freedom of movement, and based on a broader connection to their community, they should have the best opportunities to contribute to and engage with their communities themselves. Now, in Brome-Missisquoi, we are talking about a very rural part of the country. Despite challenges, stakeholders have been able to create a consultation group, and a homelessness and a housing consultation group, and we are actively participating in that. And this group has many achievements. For instance, we have warming shelters. My colleague, Mr. Champagne, was also involved. And we're also going to create a future day center for individuals experiencing homelessness. So the Brome-Missisquoi has about 17,000 people in Cowansville, and in Farnham we have about 11,000 people. But homelessness is becoming a bigger and bigger issue with each passing day. It used to be hidden or isolated homelessness, but it's becoming more and more visible. We see people sleeping by ATMs or in their cars, or there are camps, and in areas close to some shops, for instance, or in parks, people are setting up tents. Now, compared to more urban centers, of course, in urban centers, people can have access to a lot more services, but in rural areas, safety is a bigger concern. So I, of course, would have other things to say, but maybe we can do that in question and answers. Thank you. Thank you, Mr. Ranville.
Paulette, 4 or 5 minutes. You're on mute, Mr. Paulette.
Sorry about that. It has to happen. Good afternoon. Thank you for the opportunity to speak about Canada's homelessness response, and specifically the role of the federal government's Reaching Home initiative. For context, Raising the Roof is a nonprofit charity committed to providing housing solutions to Canadians by developing and preserving affordable housing and offering housing at deeply affordable rates with corresponding wraparound support services wherever possible. We have an integrated model that includes workforce development through social enterprise contractors during construction, and ongoing support services for tenants through local social service agencies that know their community, know their needs, and have the system navigation expertise to connect them to both their own services and other complementary services in the community. It is from this perspective, as an owner, operator, and service provider, that we are providing input to the committee today. First, I want to acknowledge that Reaching Home has played an important role in helping communities across Canada respond to growing and increasingly complex homelessness challenges. It has strengthened community-based planning and supported frontline organizations delivering critical services in increasingly difficult conditions. Across the country, communities are facing pressures unlike anything we have seen in decades: rising housing costs, worsening mental health crises, toxic drug supply impacts, growing encampments, an increasing number of people falling into homelessness for the first time. The reality is that homelessness is rarely caused by a single issue. As Dr. Stephen Gates of the Canadian Observatory on Homelessness has often said, homelessness is a fusion policy issue. It sits at the intersection of housing affordability, mental health, addictions, healthcare, income security, child welfare, justice systems, education, and employment. If we are serious about reducing homelessness, our systems and funding models must reflect that complexity. One of the biggest challenges today is that homelessness serving aid organizations are being asked to coordinate responses in the absence of true systems integration. Healthcare, housing, mental health, addictions, employment, justice, income support systems all operate in silos. Discharge planning, service coordination, and data systems remain fragmented across departments and sectors. As a result, frontline organizations are left bridging gaps that should not exist in the first place. We see the consequences every day. Shelters are becoming de facto mental health facilities. Outreach workers are responding to addictions crises without adequate clinical supports. Housing providers are increasingly expected to deliver complex health and social interventions without the operational funding required to do so effectively. At the same time, many people experiencing housing instability are not only looking for housing, but also for pathways back into stability, purpose, community, and employment. That is where the next evolution of Reaching Home should go. We need to move from a crisis response model toward a more integrated prevention and stabilization model, because homelessness is rarely sudden. In many cases, it is a cumulative result of missed intervention points across, again, housing, healthcare, child welfare, mental health systems, addiction systems, education, employment, and income supports. But because systems remain fragmented, these warning signs are often treated as isolated issues rather than signals of escalating housing instability. As a result, intervention frequently happens only after the crisis has intensified, and costs have multiplied across shelters, healthcare systems, policing, and corrections. We need to shift from managing homelessness to preventing it. That means investing concurrently, earlier, and more intentionally across departmental domains in housing stabilization and eviction prevention, mental health and addictions care, discharge planning, youth intervention, employment pathways, income supports, and community-based supports. Prevention is not only good social policy, it is also sound fiscal policy. The evidence is clear. Preventing homelessness is significantly less costly than responding after people have entered repeated cycles of crisis care and emergency system use. We also need to recognize that integrated systems produce better outcomes than fragmented systems. That includes stronger alignment between affordable housing development, supportive housing, workforce development, including social enterprise, healthcare, and long-term community inclusion. Within that continuum, supportive housing is particularly important, but also significantly more complex to deliver than housing alone. It requires not only capital funding for units, but also long-term operating funding for mental health supports, addiction services, case management, staffing, and ongoing building operations. Too often, capital and operating systems remain disconnected across governments and departments. This makes supportive housing difficult to finance, scale, and sustain over time, particularly for the most vulnerable populations. If we want supportive housing outcomes, we need funding and policy structures designed to support integrated service delivery alongside housing itself. On affordable housing more broadly, we also need to recognize that new supply alone is not enough. Preserving existing affordable housing is equally critical because every unit lost through disrepair, conversion, or market displacement increases pressure on homelessness systems. Preservation is often faster, more cost-effective, and more stabilizing than rebuilding alone. There's a clear opportunity for Reaching Home as part of a broader system strategy to work more intentionally alongside efforts to preserve and expand deeply affordable housing. Finally, we must strengthen the data and evaluation systems that support coordination and prevention. Community organizations need accessible, real-time tools that help them identify housing instability early, coordinate care across systems, and measure long-term outcomes. Without strong data and evaluation systems, we are making some of our most important investments without the feedback loops needed to improve them. Ultimately, homelessness reflects the systems we build and the policy choices we make. Reaching Home should continue to evolve, not simply as a homelessness program, but as a part of a broader national social infrastructure strategy that recognizes housing, mental health, addictions care, employment, and community inclusion as inseparable. Thank you.
Mr. Bullitt. We'll now begin our first 6-minute round with Mr. Aitchison for 6 minutes, and I will be fairly disciplined on the time.
Thanks, Mr. Chair, and thanks to the witnesses. I'd like to go right to Mr. Pollitt, actually. I really appreciate your comments about the fragmented nature of the system that exists. Not really even just between levels of government, but there is some fragmentation there, of course. Interestingly enough, I was just chatting this weekend with the Ontario Associate Minister of Municipal Affairs and Housing. He just so happens to be my counterpart provincially in Parry Sound Muskoka, and he's a good buddy. We went to high school together. We've known each other a long time. But I also chatted with Minister Parsa, who's the Minister of Families, Children, and Children, Community, and Social Services, about this issue. And actually, it was Minister Smith that actually said, you know, it's the way we fund shelters, for example, provincially in Ontario. Is that oftentimes there's money from one ministry, healthcare is a little bit included as well, housing's sort of part of it too, and then oftentimes that money goes to like a local service provider, like a regional government, as the case in Niagara, for example. And all too often, you know, those funding models are based on the number of beds, and it doesn't always take into account, you know, everything else that needs to go with that. I wonder if you can speak to what you would do. Like, let's say you could wave a magic wand and you ran everything in Canada. How would you change the system so that it wasn't so fragmented at, I guess, all levels of government, but particularly at those levels of government that actually deliver this service?
Happy to answer the question. You know, taking into consideration what the former panelists had talked about, not everyone who's experiencing a mental health issue is experiencing or, you know, is at risk of homelessness, to be really clear. So you still want to make those investments. But where they are, you think about, you know, investments through Health Canada, for example, around, you know, mental health challenges, issues for youth experiencing homelessness. What are the common set of goals that you want to achieve with those investments? You know, youth employment strategy, the list goes on around for those young people, in that case, who have that common set of concerns, issues, and happen to be falling into homelessness or housing instability. Can you not create a common set of goals that you want to achieve with those multiple strategies? So first, it starts with, you know, like any good organization, getting your own house in order around bringing these departments together to say, look, you know, when we touch each other's, clients or people that we're trying to support, what are the indicators we're looking for? What are the outcomes that we're trying to achieve? And can we not co-invest? It's sort of like the federal government coming up with its own co-investment strategy. Anyway, I can go on, but perhaps I'll leave it right there for now.
Thank you for that. And I guess since this is the federal level of Parliament that we're talking about, you know, there's going to be a report come from this committee that will be presented to the House of Commons. And so I think it might be safe to say that there will be maybe some comments in there about maybe what provinces can do. But is there something specific that the federal government could be doing in terms of the work that it does with provincial governments to change the way we look at this? I'm wondering if you have any specific thoughts about federal policy.
I think from my perspective, the best way to kind of answer your questions is through examples. So, if you look at, you know, what the federal government's trying to do in terms of labor market attachment, what you're trying to do from a business development perspective. Well, you know, I happen to know, and I know you know this as well, we've had these conversations around a growing number of social enterprises built and designed to support people around their needs. And when they have that, and we actually have a pathway to viable social enterprise, they create tremendous value in terms of not only labor market attachment and business development and value for communities, they also go a long way to providing people who also need affordable housing with a pathway to a brighter future. So is that not a way, an opportunity to, co-invest based on a combined set of principles and goals that both of those parts of the federal government are trying to achieve? And you can take that and break it out to any combination of departments: health, justice, employment, education, all of those investments that are being made by the federal government now. How do you jointly target a group of people who at the same time need housing stability, for the experiences?
So it sounds like what you're talking about is real partnership between levels of government.
Oh, absolutely. But I mean, if the federal government was able to kind of, like I said, get its house in order around those common objectives that it wants to achieve, I think then you spend this, I'm not an expert in federal provincial policy, don't get me wrong.
It's
but I think you have
yes.
Yeah, I think then you have an opportunity to go to provinces with a much more coherent strategy. These are the factors. We want to co-invest across all these domains, across various departments in the federal government. Now, have a conversation across those same domains with the provinces. I think you're more likely to achieve your goals if you know what you're trying to achieve in the first place.
Okay, thanks very much. We're out of time.
Seconds.
Now we're good.
Okay. Thank you, Mr. H. Monsieur Villeneuve pour 6 minutes.
Merci, Monsieur.
Thank you, Chair. I'd like to thank our witnesses for being with us, but a special shout out to Mr. Renville and Mr. Champagne, both of whom are from my riding. Happy to have you here. Now, you said that the government of Canada is investing significant amounts to fight against homelessness via Reaching Home, notably, and in Quebec, you were saying that a significant chunk of this money is going to the Quebec government under the Quebec federal government agreement. Now, what I'm hearing is that you are in between these two levels of government, and it's not always helpful for you. Now, I understand because I used to be a mayor, so I was in similar situations. Now, we had the opportunity of meeting multiple times, and I made a lot of notes. Now, in those meetings, we spoke about requests for projects, falling on certain dates, the timelines being very short, approval that can drag on for months, etc. Now, either Mr. Renville or, well, I don't see Mr. Champagne. Let's go with Mr. Renville. What is the main challenge? Is it the level of available funding, or is it the way in which the funds are distributed and managed? Well, I think it's, first off, can you hear me? First off, I think it's the level of available funding. As Mr. Champagne was also highlighting, the riding of Bromissisquoi is not a designated community, but the phenomenon has gotten worse since the pandemic, and there are real needs. Now, Cowansville and Farnham, we opened a warming center for winter time, and Mr. Champagne could speak to this as well, but we have a day center and temporary housing. So we've been able to create all this by getting together. So I think we need to be mindful of the fact that more and more rural communities are having homelessness-related issues, and these communities aren't always ready to face these challenges. So we need the funding and the means to be able to do that. The community needs to adapt, and the organizations working in this realm are also having to adapt to this new reality. And we really want to help these people out. I have a question to Mr. Champagne. How has homelessness changed in your community over the last 5 years? Well, in the last year, we've had a 12-fold increase in the number of people coming to these warming centers. So 12 times the number of people coming in. In 2022-23, we had maybe about 50 people experiencing homelessness. But in 2025-26, we had more than 100. So it has doubled, I would say. Okay, thank you. I am trying to ask you many questions because I have so many questions. Now, Mr. Ranville or Mr. Champagne, have you had to reduce or interrupt services due to delayed funding? Have we had to interrupt services because of a lack of funding under Reaching Home? Because of delays in getting the funding? Not to my knowledge, but there have been times when we had to act quick to ask for funding to be delivered in rather short time frames. But I don't think we got to the point of interrupting services due to delayed funding. Thank you. I think I have enough time for a last question. How do you think we can improve the current funding mechanisms to support rural parts of the country? This is the last question. As I was saying in my opening remarks, money should really come down directly to the different RCMs or rural communities, and that would take an agreement with the government of Quebec. Well, I seem to have a bit more time. Have you seen different realities in rural parts of the country where you are compared to urban centers? Yes, a lack of funding will be the first, and urban centers are well organized, but we are having to build everything from scratch. Thank you, gentlemen. I could, of course, ask you questions for another 20 minutes. Thank you, Mr. Villeneuve. With 3 seconds to spare.
Madame LaRouche.
Ms. LaRouche, for 6 minutes. Thank you very much, Mr. Chair. First of all, I'd like to thank Mr. Pollitt for being with us. Now, this study reminds us the needs in terms of homelessness. Of course, I will have a first question to Mr. Renville from the CDC Missisquoi and also to Mr. Champagne. You two are maybe playing dual or multiple roles because you work with the CDC, which recently celebrated its 35 years in your region. So first off, I would like to congratulate you for the work you do day in, day out. You welcome people, you help them out. So thank you very much. Now, as the MP for Shefford, we are from the same region. There are some overlapping organizations. So I also have many questions. I agree with Mr. Villeneuve. We can ask you so many questions. You are bringing the rural point of view into all this. But when you are a designated community, it has a clear impact on the Reaching Home. In Sherbrooke, for instance, gets the funding, but Cowansville and Granby doesn't always have the sufficient level of funding. So as you're saying, these urban centers are better centered, better organized, better structured. So it's very important to expand the Reaching Home program to other communities other than Reaching Home, other than the designated communities. Well, I think when you look at the definition of a rural community, we're talking about 10,000 people. And Ms. LaRouche, of course, you know that Granby has way more people living than 10,000. There are, of course, smaller parts. of that region. But of course, these cities, their populations have increased significantly in the last decade. The demographics have changed. As a result, we are faced with the challenge of course, coexisting with individuals who might have certain challenges, certain difficulties in life, and it has been getting more and more visible, and people are asking maybe questions. In some cases, maybe they're not as open to these sorts of cases, but I would still say that we have very good communities. It's also important to respect the natural, already existing communities. For instance, Missisquoi, you have 21 municipalities that function together as one unit. For Granby, it's a different reality. Of course, it's part of a different RCM. So these designations and these divisions already exist, and there are some naturally formed communities. Thank you very much. Mr. Champagne, you did a very good job explaining the impact of reaching home for people experiencing homelessness. And this year I got together with an organization from Shefford, and he also made the point, when you are having to wait for funding, whether the means you have will be renewed for encampments or other places or other groups of people, that is hard. So have you also seen some of the consequences of these delayed announcements or delayed funding? While yes, we had to stop our warming center on March 31st. It was still very cold, but we didn't know if additional funding was on its way. There are also other organizations that have lost their social workers, leading to a weakening of their relationships with people who need assistance or other organizations, because we, or they in that case, didn't really know if they were getting funding so that they could continue their services for encampments. So on your end, Mr. Renville, do you have anything to add? Mr. Pollitt spoke about this. There's, of course, the prevention aspect of homelessness. Now, I will wear my other hat, if you'll allow me, Ms. Lerush, because I work with this other community organization working with youth. So I think, in that sense, prevention is very, very important. If the tap is leaking, and if more and more people are starting to experience homelessness, well, that clearly shows that we need measures to start reducing that number. So prevention is very important. So reaching home has many parts to it with different types of funding, but we need to also make sure that young people do not end up in precarious homelessness situations. Thank you, Ms. Lerush.
4 or 5 minutes.
No,
Mr. H. Mr. Reynolds, whoever wants it quickly. Mr. Reynolds, 4 or 5 minutes.
Thank you, Mr. Chair, and thank you very much for witnesses for coming here today to discuss this important topic, and thank you so much for all of your hard work to address this important issue and a growing problem in our communities. My first question for you is for you, Mr. Pollitt. You had mentioned in your opening statement that prevention is where the money is going to be best spent. What is the number one thing that government can do to prevent homelessness?
Muted once again. I think, it's easy to think about prevention when you think about young people, but let's be clear, it is an opportunity for all populations. That moment in time when someone is about to become homeless, If you cannot prevent it, then intervening as quickly as you can to get them out of that circumstance as quickly as possible. I think, the Observatory on Homelessness, for example, created a graphic many years ago now that talked about our largest part of our money right now goes into a crisis system, with very little going into prevention and very little going into actually, interventions that are better options in a crisis-driven intervention. So the model really talked about shrinking the crisis response. It will always be necessary. The example I always use is someone's going to always break their leg in the middle of the night, so you need a crisis response similar to healthcare. But most of your money should be going into prevention and or getting people out of that situation as quickly as possible. Like Michael Lethby from RAFT, I've known Michael for a long time. Similar to him, I ran a youth organization for 24 years. 20 odd years ago, we created a shelter, and then we made the decision that we would never, apply for funding for another shelter bed again. We pivoted our attention to build housing, and as much of it as possible as supportive. One of the challenges right now in the country, I'll talk about housing specifically and housing development, as we all want to house the most vulnerable in our communities. We often want to do it with very challenging and sometimes limited capital resources, which means the depth of affordability is affected and so on and so forth. But the other side of it is we often want to house people with, some pretty high needs with the lowest possible investment in support. I think one of the other panelists also talked about, we know very clearly after 30 years how to set people up to fail. It's not because people in those systems want to set people up to fail, but as systems, we are so addicted to crisis that the only investment we ever think about making is what do we do tonight? So the federal government shifting to prevention means that we have a longer view of what we're trying to solve for, and the interventions and prevention work and intervention work follows.
Well, thank you. Another question I have for you, I know that you mentioned homelessness is obviously very complex. It's a very complex issue. But in your opinion, and in your experience, what would the number one reason for homelessness be? Number one cause?
The number one cause is obviously something going sideways in someone's life that causes their housing to break down. In the case of youth, obviously, something's going on in the family unit that doesn't work for either the family or the youth or both, and therefore you have youth homelessness. For older adults, it could be a combination of a serious workplace injury, addictions, mental health, all of the list is long. I work from the perspective that, if you solve for across all these systems I mentioned earlier, what's getting in the way of someone thriving and succeeding, the outcomes will follow that. For example, if you have an employment or labor market strategy that targets, to some degree, people who are at risk of homelessness, well, your intervention cannot simply be, okay, let's get them a resume, let's do X, let's only employment-related interventions. If you have interventions that are more broad around housing, employment, and education, they will hit what you want to see them do from an employment and labor market attachment perspective. Being more holistic in terms of it's not about the activities as defined by individual departmental mandates. It's about the outcomes. So hopefully that answers your question.
Yes, thank you. My next question is, there's been a lot of discussion about wraparound supports that are needed for individuals. Can you explain the phrase wraparound supports and what that means to you?
What that means to me is, again, I go back to my previous comment, whatever's getting in the way or causing someone to experience housing instability or homelessness. Again, I'll go back to my youth homelessness days. I often said to our staff, you could be working from a housing perspective. Some staff are working from an employment perspective. Some people from a mental health or addictions perspective. Those are just variations on the theme. Your job is to support that young person about whatever's not going well for them in their life, address that, and then the outcomes will follow. So I think wraparound support is you show up to work one day and whatever's not going right for the people that you're trying to support, that's your job, helping them navigate those challenges and then some of the other outcomes that you would like to see them achieve. And they themselves, I never met a young person in 25 years of work that didn't want a better life. Their life was just in a very different place right now. So being realistic about what the challenges are, make sure the support is there. We did a lot of work with pregnant and parenting young moms. It wasn't about offering them parenting skills. important skills, don't get me wrong. But if you supported that young woman as a human being first, give her what she needs by way of support, access to decent, safe, affordable housing, first thing she wants to do is go to school, create a better life for her and her kids. First thing, then she wants to go to work. Anyway, sorry.
Thank you, Mr. Reynolds.
Thank
Mr.
you.
Pollitt, you may be able to capture that. But our next, Madame Desrochers, pour 5 minutes.
Oui, merci, monsieur.
Thank you, Chair. I will share my time with my colleague, Natalia. Now, Mr. Ranville, Mr. Champagne, first off, thank you very much. Thank you very much, Mr. Pollitt, as well. This is very useful because we're developing an action plan, a national housing strategy. I just want to reassure you that everything you're saying in terms of the difference in terms of approach towards rural communities, it's really heard loud and clear, and it's really top of our list in terms of priorities. Just to reassure you, we are really looking into it.
Mr. Pollitt, and I was really curious about where you talked about workforce development, and I'm assuming that means, like, you know, on site we're helping residents with training that they can take into the workforce after, and so if that, like, what are some of the lessons learned you can share? Is there any targeted federal training program that you are able to access or that we should consider putting in place, and also, like, what else can we do to be helpful specifically with workforce development?
Apparently, I'm horrible at turning on my microphone. So when I think about it, I'll give you some examples as well from my past. Developing 5 units of affordable housing, fantastic. You know, you can look at it, the benefits to the community start when you give the keys to individuals who desperately need that affordable housing. But 18 months earlier, training and employing, I think it was 45 young people over the course of that period to build it in the first place. And the skills and the opportunities that were created as a part of that, and it was real-time costs. That's like lots of times social return on investment. The criticism is, it's hard to calculate what it's going to save you 20 years from now. But this was savings today, savings to the income support systems, income taxes paid, and the list goes on and on. And what we talked about, guess where these young people weren't when they were working for us full-time creating that housing? They weren't in jail, they weren't in hospital, they weren't, and the list goes on there as well. So it's a really simple, but yet somehow in systems a complex, goal to achieve is that what are the benefits of taking an employment strategy approach to developing affordable housing? One of the things we recommended to the federal government a number of years ago now was if you took a percentage, 5% of the national housing strategy and said, we want to see social enterprise engagement as part of that spend, and what that would have done to the social enterprise ecosystem across the country, for one, and for two, the meaningful training and employment that you would have driven for people who also need affordable housing. It's thinking that way in terms of, like, how do we squeeze every ounce of value out of every dollar we're going to spend? And that's a much better use of money for better outcomes, quite frankly.
Thank you. Thank you very much. And if there's anything else you want to add on this, please do send this our way, absolutely. But I'll be in touch separately as well to follow up as part of the National Housing Strategy Renewal. Nathalie, je te laisse mon temps. Merci.
Merci.
Nathalie, over to you. Thank you, Chair. Through you, I have a question for Mr. Champagne. Thank you for being with us. Now, we're seeing that a lot of people are experiencing their first experience of homelessness before the age of 25. What targeted measures should we think about to make sure that youth are not falling into chronic homelessness? I think I will hand it over to Mr. Ranville because he is an expert in terms of working with youth. Yes, thank you, Cedric. Well, we do recognize that 1/3 of youth who go through social services will experience homelessness in the couple years following their time with social services, youth protection services. To answer your question, there are different support services that could be offered by social services. But we, for instance, have housing units with accompanying services that could make it easier for them to become autonomous. Now, so these units exist where we work with youth on the main concepts, main skills, cooking food, what is a rental agreement, what is about living with others. If I'm frustrated with my roommate, how can I overcome that, and how can we continue living together? So these are all targeted to help them cope with these situations, finding more flexible ways of paying their rent, for instance, if they lose their job and if their budget gets a lot more limited. There are also mechanisms. Thank you.
Merci.
Merci beaucoup, Monsieur le Président.
Monsieur Joseph, pour...
And to conclude, Ms. LaRouche for 2.5 minutes. Thank you very much, Mr. Chair. Once again, thank you, Mr. Pollitt, for being with us. For my last round, I will ask my questions to Mr. Champagne and Mr. Ranville. Now, in this second hat of yours, if you will, Mr. Ranville, this second capacity you have been doing that for years. You're working with youth. Mr. Champagne, your second capacity is working with divergent individuals. We also spoke about increasing discrimination. Now, as someone who is working with these communities, does that have impacts in terms of people's housing needs? Or, well, the more we have homelessness, the more we'll have cases of family issues leading to these kinds of situations, or bullying at school, or other situations that is really diverse and varied. A lot of the environments are gendered, of course. We also have non-binary individuals who can't find a shelter because they don't identify as a man or a woman, or so they're having a hard time finding these services. So thank you. That is quite interesting and very important. Now, I have less than a minute left to both of you. Again, tying us back to reaching home. Now, there's a bit of uncertainty with regard to the future of reaching home. We don't fully know what the government intends to do with this program. So this uncertainty, what kinds of impacts does that have on your associations when you're working with people experiencing homelessness or youth? I'll start and then I'll hand it over to Mr. Ranville. Now, we had a day center program, a warming center, and if funding is not continued, we would not be able to go ahead with these services. Well, it wouldn't be that different for us either. We had 8 spots in housing with support services that we might need to close if funding isn't continued. Thank you. Thank you, Mr. LaRouche.
Today for appearing for the committee and giving your testimony. With that, is it the will of the committee to adjourn? Adjourned.